I am Dr. Javette Orgain, the 100th President of the National Medical Association, an Associate Professor of Clinical Family Medicine at the University of Illinois College of Medicine. I served 13 years for the State Board of Health as the chair. I'm also the past speaker for the American Academy of Family Physicians. I work and serve in the community in which I live. I also do end-of-life care with Vitas Healthcare Hospice Association. I served as the Assistant Dean for the Urban Health Program in the College of Medicine, which was a program that was designed to ensure that we had the diversity necessary to graduate students of color, traditionally underrepresented minority students. And I did that because of my passion and what I had learned in my application to medical school, the problems that I might have had in terms of my own application to medical school, the problems that I had in securing a residency training program and even going into medical school to begin with. And what I learned from the programs that I participated in, the need for persons of color to be at the table in order to make the decisions necessary in regards to how students were successful as they entered into this career. As a student, I was in Project 75, and as an associate dean for the Urban Health Program at University of Illinois, I was a mentor for the Chicago Area Health and Medical Careers Program. I am a native Chicagoan, born at Cook County Hospital, now John H. Stroger Jr. Hospital. I lived on the south side initially in Dearborn Homes projects, then lived on the west side, K-Town. The black students at my high school, many of us would have been college bound if we had known about the resources that were available to us at the time. I was in the top quarter of my class. We qualified for the National Scholarship and Service for Negro Students, but the high school advisor did not send in the information in order for us to get the scholarship, did not advise us in regards to what the opportunities were for college. Fortuitously, I did get into University of Illinois undergraduate school, and I've had a good career there, more than 40 years. My high school was St. Mary High School, which was practically in the medical district. In my last year of undergraduate school, I took a course in kinesiology. I was a math major, and I fell in love with the human body. I was additionally working in the community that Racine and Roosevelt, doing a food co-op and writing health articles, even though I wasn't in medicine yet, for the neighborhood newspaper. And that was the impetus for me to continue my journey in medicine. And I applied to medical school, and honestly, I was not accepted the first year that I applied to medical school. But persistence and the programs that we talked about and the mentors that were available in Project 75, that was no longer in existence, but the Chicago Area Health and Medical Careers Program, they continued to encourage students like me and say, you can, and we did. And I got into medical school, and the rest is history. My mother was absolutely my role model. She would take me to work with her. She was a key punch operator in the beginning ages of technology, and I learned that skill. So I was in the workforce in my career early as a young student, and so she was my role model. And I tell the story all the time, and I always love to tell it. She would rather me have followed in her footsteps and been a computer operator, but I chose medicine, and that's my passion. We've come to understand, and it's been a long road to that understanding, that the social determinants of health are very important in regards to treating our patients. What we mean is that the places where people work, live, play, and sleep are important in regards to how we treat them. As we continue with trying to address those issues, we need to provide those resources. What are the problems with not providing them? One is that there's limited access. The patients that we serve are not seeing persons who look like them. And we know that there are better outcomes when the patients trust and believe and see the person who can speak their language, who understands their culture, and can address their needs. And so relating that information to the patient and being able to address those things are very important in regards to the care. What happens when it doesn't occur? We know that at times that even myself as a clinician, all of us recognize that there is implicit bias, that we bring our own prejudices, we bring our own cultural values to the table when we're treating patients. There are many stereotypes in regards to our communities, and it's important for physicians and other practitioners to address their own implicit bias while they treat patients. What happens if they don't? The research that's conducted, the care that's provided does not meet the quality standards that we believe is important to provide good, quality, comprehensive, coordinated care to our communities. As an academician and someone who found it important to ensure that those persons who get into medical school, the pipeline addresses the diversity, meaning that we need more underrepresented minorities into medical school. It is critically important to address diversity in healthcare, in the healthcare pipeline, as well as in residency programs, in the office setting, in the corporate setting even. Is very important to deal with the diversity. And hence, we must create pathways for access for student success. We have those programs that we talked about, Project 75. We have the Chicago Area Health and Medical Careers Program. We have a number of programs that have addressed it, but yet and still, the number of students who have gone into medicine, in particular African American males and other male students, it has plateaued and has remained virtually the same for at least 30 to 40 years. That cannot continue. We must make a change and be a part of the change, creating the diversity that's necessary in this environment to handle health equity. And how do we do that? We do that by creating the programs that we're talking about, the programs that I participated in as a student, Project 75, Chicago Area Health and Medical Careers Program, and programs like CPASS Foundation. It's important that we do that. It's important that students see role models and mentors, and that those of us who are committed to that stay connected. I'm encouraged that the CPASS Foundation fosters an environment that nurtures students in STEM programs as they go along the path to address health equity. We need that kind of activity in order to maintain and sustain the activities that are necessary to address the social determinants of health, to address that quality of health care that we're talking about, and to change our healthcare system for better for those who have less access, who are living in poverty, who need the quality care that a system should provide.